Hello, everyone, and welcome to Heads Up, the weekly webcast and podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel, migraine strategist, founder of the Facebook group Migraine Nation, and chronic daily migraine survivor. I'm here this week with Dr. Vincent Martin, MD. Dr. Martin is the director of the Headache and Facial Pain Center at the University of Cincinnati, and he is also the president of the National Headache Foundation. Hi, Dr. Martin. How are you doing today?
Good, Lindsay. How are you?
I'm great. So we are going to continue our discussion related to Mental Health Awareness Month, and we are going to talk about anxiety and its relationship to migraine today. So to just move ahead without any delay, I'm going to go ahead and ask Dr. Martin to discuss with us the relationship between anxiety and migraine. Anxiety has a much higher rate amongst those of us with migraine. Those of us with episodic migraine, the rate's about 20%. With chronic migraine, it's 30 to 50%. And Dr. Martin, do we know why that is?
Well, we don't know precisely why that is. And I think we had talked briefly about the association between migraine and depression. And I think the same type of a thing holds for anxiety, is that it's possible that there could be some genetic basis in which the genes that predispose for migraine could also predispose to anxiety. Mm-hmm. And the other thing is that in some cases, anxiety could be a trigger, for migraine itself. So there could be, basically could help bring it on. So you could have a period where your anxiety really kicks up, and the whole process of anxiety, which activates the fight or flight nervous system, could actually trigger some individual attacks of migraine.
Mm-hmm. So it's my understanding that panic attacks or panic disorder also happens at a higher rate in the population of people with migraine. Can you tell us exactly what that is and how it's different from generalized anxiety?
Well, let's just start with generalized anxiety. So with generalized anxiety, people are very nervous and they're kind of hyper vigilant of the environment. So basically they hyper focus on different things. And oftentimes with anxiety, people can anticipate bad consequences happening. Like if they have a small headache, they might think, well, this is going to get worse. That's called catastrophizing. So always assuming that the negative is going to happen. So this is very common in people with anxiety. Mm-hmm. Panic disorder is different. It's a discrete episode. So it's basically where all of a sudden you get real shaky and your heart starts to pound and your heart starts to race and you feel like the world's closing in and so forth. These are like discrete episodes. In fact, these can be precipitated by like public speaking, where somebody just feels like some people feel like they're gonna die when they're having a panic attack. Mm-hmm. And that's also there's also an increased rate of panic attacks within migraine patients as well. And that's a situation where instead of the fight or flight nervous system being activated at a lower level, kind of on a long-term basis, this is where you have discrete attacks where the sympathetic nervous system is going crazy during this panic attack, basically.
Okay. So my next question is a short one. Can anxiety itself cause migraine? Because is it a trigger or is it a cause? And what exactly is the difference?
Well, I think this is something that's commonly mistaken, is people often, confuse what causes migraine for what triggers migraine. So what causes migraine is probably a gene or group of genes that makes the brain hyper responsive to the environment, or very, very sensitive, if you want to think of it that way.
Right.
And there could be environmental factors too that play a role. Like maybe you've never had a headache, migraine your whole life. You take a blow to the head, and all of a sudden you have migraine-like headaches the rest of your life. So it's kind of this interaction between your genes and the environment to create this hypersensitive nervous system that we call migraine. Mm-hmm. A trigger factor is where there's some discrete factor that causes an acute attack of migraine. Mm-hmm. So basically, it could be something like a weather change, or it could be a hormonal change as well. Just one second here. Mm-hmm. You just vanished. But so things like weather changes, hormonal changes, foods, alcohol can all be triggers of a discrete attack. That's different than what causes your overall migraines.
Okay. All right. So I wanted to set that straight because I think so many people are told that their anxiety or their mental state is causing their migraines. And it's important to know the difference between cause and trigger, especially in the setting of what we're talking about today. Can you discuss how anxiety can make migraine worse? What are some of the routes that people's anxiety works in their life to make their migraine worse?
Well, I think that once again, we were talking about cause versus trigger. So in the
Mm-hmm.
case of anxiety, anxiety would mostly be more of a trigger factor as
Right.
opposed to the cause.
Right.
So there's a number of different ways. One is that when you activate the sympathetic nervous system, that fact alone could trigger some attacks of migraine.
Mm-hmm.
The other thing could be that, as we talked about before, that many times that a person who's anxious often will anticipate something bad happening and almost be hyper vigilant of things. So they
Mm-hmm.
may think that when they have a mild headache, that may actually progress on to a more severe headache, and they may be more likely to take medications, particularly if they have more frequent headaches. So they kind of get into a pattern of medication overuse, or what lay people call rebound headaches. So anxiety often drives medication overuse in people with frequent headaches
Mm-hmm.
as well. And then the third thing is that people with anxiety often will tend to catastrophize or think of all the negatives. And they also tend to hyper focus on things. And we know that if people hyper focus on their pain disorder,
Mm-hmm.
that you can turn off all the parts of the brain that are pain relieving and actually produce pain. They've actually done imaging of the brain where they apply a painful stimulus, say to the finger,
Mm-hmm.
and they actually image the brain. You can see that the pain relieving areas of the brain just get turned off if you hyper focus on the pain.
Right.
I mean, a classic example of that would be like someone who hits their finger with a hammer,
Mm-hmm.
and all of a sudden, you start focusing on your finger. What happens? It starts to throb, it starts to pulsate, and so forth.
Right.
And then if you distract yourself, what happens? The pain gets less. So you really don't want to hyper focus on pain. You want to try to distract yourself from pain, because you'll reduce the pain by doing that.
Exactly. I love that we got to that in this conversation because I find distraction to be so important when you feel a migraine coming on. So anxiety is so prevalent in our society. I think we're so used to hearing about it, talking about it. It's a very hot topic right now that it might be difficult to know when to seek treatment. So I'm curious to know when you think someone should go talk to their provider about their symptoms of anxiety.
Well, I think when it's interfering with their lives, at least when they recognize it, or I would even say this, is that sometimes the person with anxiety is not always the best judge of anxiety.
Mm-hmm.
Oftentimes it's your significant other, sometimes your friends will notice it before you do, because if you're anxious, this is maybe like I'm an anxious person, so I may not even recognize that's what's going on. I mean, the anxious person also kind of usually runs through these loops. They just keep worrying and worrying about things, and it just kind of goes over and over again. And that can happen with migraines as well.
Mm-hmm.
So,
Okay.
but,
All right. So possibly listen to someone you trust if they're telling you that your symptoms are something you should go talk to someone about.
well,
Um,
well,
so
I would just say two other things too. Is that one is that when it's impacting your life, or someone in your family or your friend tells you it's impacting, then you should probably go seek some help. But
mhm,
in migraine, if you find that you're getting really anxious about the next attack, you may be bringing on the attack and also causing more medication overuse. So if you
mhm,
notice that in yourself, then you probably should seek help.
right. Okay, that is a very good point. Um, and what do you usually recommend when one of your patients with migraine comes to you presenting with symptoms of anxiety?
Well, I think it's important to treat the anxiety, because once again, just like with depression, if you don't treat the anxiety, I think you're going to, not have as good of a treatment response. But the first thing we do are just healthy neurologic lifestyles.
Mm-hmm.
And it's amazing how important those can be, because people who get dehydrated can activate their sympathetic nervous system and get more anxious. So you want to
Mm-hmm.
make sure you keep yourself hydrated. 8 ounce glasses of water per day.
Mm-hmm.
You want to get appropriate relaxation. So you
Mm-hmm.
want to try not to overcommit yourself at work or with social events. You want to find ways to relax, and how you relax is very individualistic. So that could be it could be a hobby, it
Mm-hmm.
could be reading a book, it could be doing yoga, it could be doing other activities. Exercise is extremely important to kind of calm that sympathetic nervous system down.
Right.
So exercising about 4 or 5 days a week with about 20 to 30 minutes worth of aerobic exercise can make a tremendous difference.
Mm-hmm.
And if that doesn't work, if all these different healthy lifestyles and going to sleep at the same time, waking up at the same time, eating 3 meals a day, if all that doesn't work,
Mm-hmm.
then we could refer you to a psychologist, and you could go through some formal relaxation techniques where you learn how to do different techniques like guided visual imagery, where you envision being in a very pleasing place, and also where you learn how to relax, progressive muscle relaxation, where to relax different muscle groups and so
Right.
forth and so on, and biofeedback. So that's kind of the more formal and kind of last thing you can do. And then finally, in some cases, medications are necessary. So
Mm-hmm.
some of the antidepressant meds, besides treating depression, can also treat anxiety as well. So it's kind of like a 4 or 5 pronged approach to managing depression in patients.
Okay. Is there a difference? I do believe there's some data out there that you and I have discussed, that there is a difference sometimes between men and women and how they present with either depression or anxiety, maybe even particularly in the setting of migraine. Can you speak to that really quickly?
Yes, we did a study probably about 5 years ago where we looked at diseases that were associated with both men and women. And
Mm-hmm.
we found that the depression was more commonly associated with migraine in women. And one thing that we found was very interesting was that it was anxiety that was most associated with migraine in men.
Mm-hmm.
So, and that's not to say that women can't have anxiety and that men can't have depression. It just means that those diseases were more strongly associated with one gender versus the other.
Okay. I think that's very interesting to know, because I don't think that's common knowledge. So I wanted to make sure we slip that into this podcast for people to hear, in case they recognize it in themselves or their loved ones. Is there anything else you'd like to add to this discussion on migraine and anxiety?
The one thing else I would say is that in some cases, there's some other medical disorders that might predispose to, say, panic disorder.
Mm-hmm.
And one of the ones that it can do that is something called Ehlers-Danlos syndrome or joint hypermobility.
Right.
And this is something that people don't often know, is that when your blood vessels are more elastic, they're more likely to stretch. When you stand up, you tend to pool blood in your lower extremities
Mm-hmm.
and decrease blood flow back to the heart. And what happens is then the heart compensates for that by increasing the sympathetic nervous system, and people can have a panic attack.
Mm-hmm.
Well, a lot of people think that the panic attack is always secondary to some sort of neurologic condition, but in this case, it's related to the hypermobility and the connective tissue that tends to be more relaxed, particularly within the blood vessels. So in some cases, things like panic disorder are specifically related to joint hypermobility, secondary to a syndrome called POTS syndrome, which is postural orthostatic tachycardia syndrome.
Mm-hmm.
And when you manage that, sometimes the panic disorders can improve or even go away.
Right. And we should mention that people with POTS and with Ehlers-Danlos also have an increased rate of migraine. So they would probably be more likely to be watching this podcast. So there is, and we do have a previous podcast that speaks to POTS. So you can go and look that up if you feel like that relates to you. So thank you so much for joining us this week to hear about anxiety and migraine. We hope that it was educational for everyone, and please join us again next week on Heads Up, the weekly webcast and podcast of the National Headache Foundation.